My name is Vanessa Ann Lewis of New Life Blessings. I'm a certified doula, placenta encapsulator, and student midwife. I am here today to share with you some information and take a closer look at the ways women are birthing in the United States. Now, it does take quite some time to gather statistics, and these numbers are from the 2013 vital statistics of births in the U.S., which totaled more than 3.9 million births. The majority were attended by physicians, about 83%. Only about 8% of births were attended by certified nurse midwives, and the additional 2% were by other midwives, which included certified professional midwives, certified midwives, direct entry midwives, lay midwives, etc. And about 7% were DOs, or doctors of osteopathy. Let's take a closer look at interventions. First, let me start off by stating the rates for these interventions shown here are for spontaneous labor, and though are high, are lower than those for induced labor. The cesarean rate in the U.S. is 32.7%, meaning 1 out of 3 women have a surgical birth. This rate does change hospital to hospital and provider to provider. Things such as hospital policies, provider experience, providers' beliefs about childbirth, annual births at a hospital are more factors that can affect this rate. For example, a local hospital boasts their cesarean rate is lowest in the state at 14.3%. However, they attend an average of 19 births per month, forward their high-risk births to a larger city hospital, and have a strict ban on VBACs. Epidurals are about 70% of births. IV fluids over 60%. Catheterizations are about half of births. Women's bodies are taking the journey into labor, and yet 30% are receiving Pitocin. 1 out of 5 are having their waters broken, which has far more risks than benefit, including cord prolapse, infection, baby coming down in a malposition, and even increase in pain perception. In May of 2016, the American College of Obstetrics and Gynecology, otherwise known as ACOG, held a conference where a discussion was presented as a debate on elective induction at 39 weeks of gestation. 2 men, Dr. Errol Norwitz and Dr. Charles Lockwood, both came to the table in agreement that every woman should be induced at 39 weeks, claiming there was no benefit to the fetus to remain in utero after 39 weeks, and that the major risk factor would be failed induction leading to cesarean. Norwitz even argued, "Nature is a terrible obstetrician." These are very short-sighted remarks which completely dismiss the physical and emotional care of the mother, the potential injuries to both mom and baby during the major abdominal surgery, and future repercussions to biochemistry, and that of a growing child after extensive studies are linking cesarean birth to chronic diseases. Kristen Pachucci, an advocate for patient rights and autonomy in childbirth, believes that doctors' remarks are suggesting that babies need to be rescued by birth, creating an anti-woman mentality. She says it's as if women and their babies are fundamentally in opposition to each other, and the female body is dangerous by design. Gotta love Kristen. After the ACOG discussion, the audience was polled. 70% supported the idea of women delivering at 39 weeks, 21% remained unsure, and only 9% were against it. ACOG states the support for induction is growing. Does it surprise you that in 2013 about half of the births were inductions? And that number's growing? What else about the numbers surprised you? How about the significant cesarean rate difference between spontaneous labor and induced labor? And again, when you're looking at with and without epidural use. Why are inductions so prevalent? Well, medical reasons are the best reason to consider induction. It may be maternal or fetal health problems, but that makes up only a small portion of the inductions. Others were due to providers' concern for a big baby or being overdue, and even mother's choice. Of the women surveyed in the Listening to Mothers survey conducted in 2013, those who were induced for being overdue gave birth before their due date, on average at 39.9 weeks. And the women who were induced for a big baby gave birth to babies weighing an average of 7 pounds, 15 ounces. It takes about 15 years for research to actually get into policy and practices, and routines and policies may actually come with increased risks for mom and baby. You are different than the woman who birthed before you, after you, or in the room next to you, and your care should be tailored as such. So what can you do to make sure that you have the best birth experience possible? Well, it's fairly simple. Know evidence-based care and how to get it. Choose the proper provider. Choose your birth setting, your support team. Educate yourself and know your rights. If you'd like to learn more about this and more about the evidence-based birth course or the e-course for parents that my doula clients receive, please email me at nlblessings@gmail.com or visit newlifeblessings.com. Thanks so much for spending some time with me, and see ya! And a very special thank you to Plumtree Baby, who designed the slides featured in this video. Visit plumtreebaby.com.